Now I got it.
Okay, good.
Thank you, everybody. This is Rafael Espinosa, Director of the Montgomery County State Health Insurance Assistance Program, SHIP, and my apology for the little technical delays that we have here. That's life. It happens, you know, so sometimes it's beyond our control. We are happy to do this presentation for you. We're gonna start, so let's move the slides to the next one. These are the points that we're going to talk today. What is Medicare, enrollment periods, financial assistance, prevent Medicare fraud, abuse, and also scams, phone scams, and some small summary. Now, for those who are new to Medicare, you have to meet certain requirements in order to become eligible for Medicare. You have to be a U.S. citizen, or you have to have 5 years or legal residency and reach the age of 65. Now, also for people who are younger than 65 and they have a disabled condition, they have to be under the Social Security disability benefits for at least for 2 years. And also they need to meet the citizen criteria as well, the legal residency 5-year ban. Now, Medicare provides you 2 options when you enroll. The first option is to stay as original Medicare, or the second option to, as soon you enroll, to enroll or become part of a Medicare Advantage plan. So those are the 2 options. We're going to talk about option 1, which is the original Medicare. If you decided to go that route, original Medicare has Part A, Part B. You need to enroll in Part D, and you need to buy your Medigap or Medicare Supplement policy. Now, when you are using your Medicare, your insurance, you need to know what Medicare Part A covers. It covers hospitalization. It covers a skilled nursing facility, home health care, and hospice care. As well, you need to know what Medicare Part B covers, is the medical piece of it. And they cover doctor services, preventive services, diagnostic tests, outpatient care, also home health care when it's prescribed by doctors, you know, and durable medical equipment and therapies. For some people who doesn't know what durable medical equipment are, those are, let's say, wheelchairs, walkers, canes, modified hospital bed that you need probably at home. Those are the medical equipment that Medicare Part B covers, and some other equipments as well. Now, usually Part A doesn't have a premium because you meet, if you have been working for 10 years, you have meet the 40 Social Security credits. But Part B, and on the other hand, everybody pays Part B, regardless of the credits. So, and this is based on your last 2 years income tax. They will base their your Part B premium and your last 2 years income tax. If you enroll in 2020, they will look at your income tax for 2018. Now, Part B has a deductible, which is $195 per year. Okay, and also Part B doesn't cover 100%. It only covers 80%. So 20% is your co-insurance. And you have to come up with a payment. That is why it's very important to have your Medigap or your Medicare Supplement, because of those share costs that you have by using your Part A, by using your Part B. You have Part A, Part B, deductibles, co-pays, and co-insurances. if you have the right Medigap plan or Medicare supplement, that will help you cover those expenses. Obviously, in order to get this Medigap, you have to be enrolled in Part A and Part B. If you just have Part A, you cannot get Medigap coverage. Or if you have just Part B, you have to have both. Now, these are individual plans. So, you know, husband and wife, each one of them have their own Medigap policy plan. Okay. The plans are standard. What that means? That means that no matter where you get it, what insurance company that you get your plan, you will get the same coverage. The only difference is the monthly premium that you're going to pay. In some, it's more expensive than in others. Now, in order to get a copy or learn a little bit more about the Medigap or Medicare Supplement policy plans, you can call the Maryland Insurance Administration 410-468-2244, or you can go to their Maryland Insurance Administration website. As well, you can go to our website, which is www.medicareabcd.org. And also you can find over there the Medicare Supplement or Medigap policy book. You can get it there. You can see all the insurance companies that provide Medigap coverage. You will see charts in there telling you what the plans are and what they cover. And also you will see in there the premiums. And the premiums are set by individual insurance and also by your age of enrollment. So all that information you will have in that Medicare supplement policy book.
Raphael, may I interrupt? This is Beverly. Can you just give us that website one more time for you guys to get the booklet?
Sure. It's www.medicareabcd.org.
Got it. Thank you.
You're welcome. Once you enroll in Medicare as original Medicare, you need to be careful where you're going to get your medical services. You need to go to providers that participating with Medicare. It's very important because they will take the Medicare payment and they will not charge more than the 20% copayment that is your responsibility. So they're signing a contract with Medicare. So that is the kind of doctor that you will always look for it, okay? If you are new and you want to find doctors, please find these kind of doctors. We call them, they take assignments. It's very important. You will not get billed more than the 20%. Now, if you go to doctors that are not actually assigned with Medicare, means they don't have a contract with Medicare, you can still see these doctors. They will take Medicare payment. They will take the 20% that is your responsibility, but they can charge you up to 15%. If you have the right Medigap plan, they will take care of it. So you don't have to worry about it, okay? So when you do you research for Medigap plans or Medicare supplement, make sure that you get the right one to cover you the most, okay? And there are different plans. If you need more detail or you need counseling about which plans are good for you, you can call us. We can go in more detail about the different plans if you wish. Our phone number is 301-255-4250. 301-255-4250. Now, this is a problem if you go to a doctor that has been opted out from Medicare. Sometimes you don't know that, and you just go, they tell you, pay us upfront, and then you submit your claim to Medicare, and you will get your money back. If there are opt-out doctors, unfortunately, you will not get your money back. So you will not see any reimbursement. That's Medicare rule. Now, if the doctor is new, is a new doctor, never has dealt with Medicare before, and they decided just to start taking Medicare patients, yeah, you can submit your claim to Medicare and you will possible get your reimbursement. But it's better not to go through that headed. Just go to doctors that actually are contracted with Medicare, doctors that are assigned with Medicare. You will avoid all these issues, you know. But you have the option. Now, prescription drug plans, if you are in original Medicare option 1, you need to pick your prescription drug plan as well. So we are talking about getting original Medicare. You get your Medicare Part A, Part B. You're gonna buy and get your Medigap Medicare Supplement, and you also need to get your Medicare Part D, your prescription drugs to cover all your medications. So you need to do that as a option 1 as a original Medicare. Now, if you decided to go option 2, most of the Medicare Advantage plan provide you also prescription drug coverage. So you don't need to enroll in a prescription drug standalone plan. Now, this is what Medicare doesn't cover. You know, long-term care, nursing homes, basically. Now, if you have been in the hospital and the doctor wants to see how you can improve if they send you to a long-term care, they can do that. They have to be very, medical needs that they're gonna actually do some medical services to you in order for you to get back to your fee. You can be sent to a long-term care and Medicare will pay, but it will pay only for short-term. It will not be a long-term. So that Medicare maybe take care the first 30 days. Okay, but after that, if there is no reason for Medicare to continue paying, then unfortunately the long-term care stay will be your responsibility. A lot of people get a long-term care insurance coverage to prevent those costly, because it's not cheap, it's very expensive. So to prevent those high costs. Now, Medicare doesn't cover dental care neither, or dentures. The Congress was in conversation before the pandemic to add dental coverage to Medicare. Unfortunately, due to this virus, everything is stopped. Hopefully for next year, they will retake these conversations. And hopefully by 2022, we will have dental coverage in our Medicare, hopefully. Now, hearing aids doesn't cover. Routine eye exams or glasses doesn't cover neither. Cosmetic surgery, nope. Acupuncture will cover only if the doctor prescribes it as a medical necessity. And you have to do your acupuncture in medical certified centers. You cannot just go any place that do acupuncture, okay? So you can do that, but in most of the cases, they don't pay for it. Now, option 2 is the Medicare Advantage, or Part C. Medicare Advantage include Part A, Part B, and Part D, and some vision, dental, and hearing. It depends the plan that you get. So all the services that this Medicare Advantage plan offer are part of the Part A, Part B coverage. Okay, you may get some additional coverage, but you cannot get less than what Medicare already cover. Okay, that is for sure. These are the private insurance companies that provide health coverage to all the Medicare beneficiaries that enroll with them. And they also follow Medicare rules. Once you enroll in a Medicare Advantage plan, you no longer use your Medicare as your insurance. you use the Medicare Advantage plan insurance to get all your medical needs. And they will provide you a Medicare Advantage plan insurance card. You will put your Medicare card aside, you put it in your wallet, and then you keep it there safe, you know, because you are not using it. You are using the insurance. In order to get to be able to enroll in a Medicare Advantage plan, you have to have Medicare Part A and Part B. Same rule as the Medigap or Medicare Supplement. You cannot have only Part A and enroll in Medicare Advantage, or only Part B and enroll in Medicare Advantage. Unfortunately, you have to be enrolled in both. You have to pay for this Medicare Advantage. You will have a small premium, you know, and also you will continue, since you are, in order to continue having your Part A and Part B and be able to join this Medicare Advantage plan, you have to continue paying your Part B premium. Even if you no longer use your Medicare, you still have to continue paying your Part B premium. Okay, some people believe, oh, now that I'm enrolling in an insurance plan, I'm not using Medicare, so I don't need to pay anymore. That's not true. Okay, you still need to pay your Part B premium. Now, these Medicare Advantage plans have Medicare Part A, Part B, and Part D prescription drugs all together under the insurance coverage. You have different plans, obviously with different premiums, different requirements. Most of them provide you prescription drug coverage. You don't have to enroll in a prescription drug plan by yourself. It will be part of this insurance. They will provide you some extra benefits that Medicare doesn't cover, like vision, hearing, dental, and some routine physical exams. They will be, you know, a premium that you have to pay, but they will be low. Right now, it's estimated for 2021 that probably is going to be in the range of 21, the lowest, $21 per month. You will have some annual out-of-pocket limits. Right now it's $6,700. I believe for next year maybe will be below that. So I don't have the number exactly right now, but I'm pretty sure it's going to be below. The government has been pushing for these Medicare Advantage plans to, you know, to be more active. In Montgomery County, in our county, it's sad to say, but you know, most of the Montgomery County residents do not enroll in a Medicare Advantage plan. And there is a reason, because many of these Medicare recipients, they are federal retirees, and they already have their, you know, coverage as a federal employee with the federal employee health benefits. And they don't need, not even Medicare Advantage. They don't need a Medigap or Medicare Supplement neither. So that's why in our county, many of our Medicare recipients are in those conditions, not only federal, but also county and state. So they have certain benefits that others don't have. And also some people believe that, you know, they value their freedom to go to any doctors that they choose. By being original Medicare, you can do that. By being part of a Medicare Advantage plan, unfortunately, you're going to be part of a network. So you need to ask yourself these questions. If you travel a lot, you know, going visit friends and family members, going around United States, you know, and you need to see your doctor with frequency, or see a doctor with frequency or a specialist, then Medicare Advantage plans is not for you, you know. Also, if you don't have the means to pay a Medicare policy, because it can range in between $130 to $189 just to start, and that will maybe increase, okay, over the years. So if you maybe knowing the capacity to pay those premiums, maybe Medicare Advantage plan is you plan. So you have to ask those questions. Also, if your medication is not covered at the Medicare Advantage plan, Part D coverage, then you may need to stay away from Medicare Advantage plan and get your own prescription drug standalone plan, because those will cover your medication. So there are questions that you need to ask yourself in order to make the right decision. Additional to, what doctors are available to you in your area, what are the hospitals that the network work with, it is, any other facility that you may need some sort of services, scans, radiology, all that kind of questions. We usually do not ask, but when we need medical services, we need to ask, because you don't want to go all the way to Baltimore just to get a scan. So that's why you need to ask all those questions, or go all the way to downtown DC, So what you see in your screen is the differences in between original Medicare and Medicare Advantage. Also, they have some similarities in there. Both of them covers obviously Part A, Part B. And then in the Medicare Advantage case, they include the Part D benefits, which is the prescription drugs. In the original Medicare, you have to enroll in your prescription drug plan. As I mentioned before, as original Medicare, you can go to any doctor in the US that takes Medicare. If you like that freedom, then original Medicare will be your plan. Medicare Advantage plan, on the other hand, is restricted to in-network providers. That is a big difference. Some people value that a lot. Also, with original Medicare, you don't need a referral to see a specialist. With Medicare Advantage plans, you need to go and see your primary care and then get a referral in order to see a specialist. There are extra steps that you need to take. In original Medicare, you will have Part A hospital, deductibles and coinsurance, and obviously, for some people, Part A premium. Plus the Part B deductible, premium, and coinsurance. Now, if you have the right Medigap Supplemental, you may avoid all those costs except for the Part B deductible. Because if you are new to Medicare, if you get any plan right now that is available to you, Part B deductible is not covered. Also, the premium, Part B premium, Medigap or Medicare Supplement doesn't cover your Part B premium. Some people thinking that, Medigap, since it's a supplemental, will help them also with the medication. And unfortunately, that's not the case. Medigap only covers, Part A and Part B co-payments or coinsurance. And depends on the plan, you may get a Part A deductible cover. Okay, if you are a person that's supposed to be enrolled a year ago, 2 years ago, but you delayed it because you you keep working and you have health insurance, and now you're enrolling now, then you can get a better plan that will cover the Part B deductible as well, which is Plan F. But for new ones that just enroll, unfortunately, that plan is not available. In Medicare Advantage plan, since you don't have those costs, everything is fixed. You go to a doctor, you pay your $5 copay and call it a day. So you don't need a Medigap Supplemental to help you pay all those extra costs. And besides, it's against Medicare rules for a broker, insurance broker, to sell you a Medigap plan knowing that you have Medicare Advantage plan. Okay, so you don't supposed to have a Medigap plan if you have Medicare Advantage. Now, these are the enrollment periods. If you just turn 65, that's your initial enrollment. You enroll in Part A, Part B. You pick your prescription drug plan at your initial enrollment. Also, you pick your Medigap plan or Medicare Supplement at that initial enrollment if you want to continue as original Medicare. Or you enroll in Part A, Part B. You don't pick Part D, you don't pick Medigap, but you join a Medicare Advantage plan. You can do that at the initial enrollment period too. Now, the special enrollment period is mainly for Part B, and that is for people who reach 65 and they keep working and they delay their Part B enrollment. That is called a special enrollment period. But it's not only for Part B. Also, at that point, you may need to enroll in a prescription drug plan as well. So Part D is for both, but mainly for Part B. Now, the general enrollment period is when you miss your initial enrollment period and you want to enroll in Medicare. You can do that in between the months of January and March of every year. And when you do that in that general enrollment period, your Medicare become active July 1st of that year. So you may create some coverage gap in there. Okay, unfortunately, that's a medical rule. Currently, we are in the open enrollment period, and that's from October 15 through December 7. And what you can do in the open enrollment period, you can switch your prescription drug plans. If you have a plan that you'll be notified that no longer will cover your medication or it's going to increase your medication costs substantially, then this is the time to switch to a more cost-effective plan. So in other words, cheaper plan, and this is the time to do the switch. This is the time to find a plan that will be more favorable to you for 2021. And we can help you do that. You can actually request from us to help you do what we call an analysis, a prescription drug analysis, and we can help you find one or two plans favorable to you for 2021. Or we may tell you, you know what, the plan that you have is the best plan for you for next year. So, but we can help you, and you can get our prescription drug forms. You can download it from our website. Again, I will repeat that. It's www.medicareabcd.org. You can download the form from there and mail it to us. Or if you wish, you can submit your electronic form in our website as well. So you don't have to mail it. You can do it right there. Okay. Our replies to you, our results, it can be done also in two different ways. We can send it by email as you requested it, or by mail. Okay, so you can learn about that when you go to our website, but we are providing that services to every Montgomery County Medicare beneficiary that requested it from us. It's a free service. Take advantage of it. Okay. Also, the open enrollment period is to, if you are original Medicare for quite some time and you no longer want to be original Medicare and you want to join a Medicare Advantage plan for next year, this is the time to do it. Okay, you pick your Medicare Advantage plan and you enroll, and this will become active January 1st of 2021. Okay, so these are the periods. Now it's another enrollment period called Medicare Advantage enrollment period, which is from January to March as well. It's not listed there, but I will talk to you about it. In that Medicare Advantage enrollment period, you can drop your Medicare Advantage plan and go back to original Medicare. Or you can switch Medicare Advantage plans. If you have a Medicare Advantage plan, you can switch to another one that is more favorable to you. So, and that again is in between January and March. Okay.
Okay, Raphael, I'm sorry to interrupt, but there are people in the waiting room. Can you just let them in? They've been waiting for a while, and I can't do it.
Okay, what I need to do? Invite?
Yeah, no, there's a waiting room and just say admit.
I did.
Okay. Yeah, that's all.
Oh,
Whoever's in there.
admit. I didn't realize that. I'm sorry, my apologies.
No, my apologies, Jim.
You're in.
Here it goes.
I think we have all, right? I think we have it all. Yep. Sorry for anybody who's just joined us. You know, unfortunately, we had some technical difficulties. Okay, what you have in the screen is financial assistance. These are 4 programs that you can get through the county, the state, and even Social Security. I'm going to be very briefly about it, but if you wanted more detailed information about these programs to help you with your Medicare costs, or you want to refer people that maybe need assistance with the Medicare costs, please send it to us and we'll be more than happy to assist them. I will give you an idea what these programs, what the benefits are, okay? Qualified Medicare Beneficiary, QMB, that will help you with your Part B premium, monthly premium, and will help you with your Part A, Part B, the deductible, and copayments or coinsurances. So basically, it behaves like a supplemental. It will cover everything after Medicare pays. It's a very good program. The Specified Low Income Medicare Beneficiary, SLMB, it will pay only your Part B premium. That's it. No more. For some folks, it's a good help, you know. The low income subsidy or extra help, that will help you with your prescription drug premium up to $30 and with your medication costs. Your medication will cost you in between $3 and $8.90, in between that range, no more. The Maryland Senior Prescription Drug Assistance Program, that will help you cover up to $40 your prescription drug premium. And also will reimburse you based on how much you spend during the year. The following year, they may reimburse you some money, okay? But you have to be for a year in the program. So those are the 4 programs. Again, if you need more detail or you want to refer somebody for more details about these programs, please give us a call, 301-255-4250, 301-255-4250. Now, it's important to prevent a Medicare fraud. You know, Medicare lost a lot of money. Probably you all already know that. You know, it's nothing new about that. So, by how you benefit by preventing it? How you as a Medicare beneficiary benefit? Because you may say it's not affecting me. I'm not the one paying it. You know, how affecting you by being services and coverage reduced. You know, by charge you more in your Part B premium. By doctors being paid less. So when that happened, doctors, for instance, decided, oh, you know what? I no longer will participate with this Medicare because I just get pennies. No, I prefer to do it with the insurance companies. I get more money through them. So you will see less and less doctors participating with Medicare. You know, you will see increase in premiums, and you will see a decrease in coverage. So that's why it's very important for everybody to participate in the prevention of Medicare fraud or any abuse.
What I thought it would be. It's
It's
not.
for Medicare.
Yeah, I think I'm okay. I don't think I need
Yeah,
that.
okay.
Thanks. How are you
Barbara,
doing?
can you mute them? Okay, I hear some people talking. Can you please mute yourselves? I would really appreciate it. Thank you. So the abuse also, you know, if you prevent it, how you prevent it? By reviewing your Medicare summary notice. If you have not created your account with Medicare, you will get these notices quarterly by paper. But if you have created your account, then you can review your notices monthly. You just open your account and you can see. It's better monthly because sometimes we forget who we see, especially you never see that doctor before, you know? So you may think, I've never been there. And then until you thinking for 10 hours, then you say, yeah, now I remember. I went there. So it's better to look at it monthly, you know, that way you keep eye in what is being, you know, billed to Medicare. You are the first line of defense. Nobody else can tell Medicare, yes, I have received these services. No, I have not received these services. I've never been in that doctor's office. You are the only one. Nobody else can do it. So keep eye on it, all right? It's very important. Also, I want to talk a little bit about phone scams. You know, probably you're receiving phone calls. You have not be in the watch out, you know. There are a lot of phone calls made to people telling them that from Social Security, telling them that if they don't act immediately, they will lose their benefits. And they tell you dial 1 or 2, one of those numbers. And then they ask you when you do that to provide, of course, all your personal information, Social Security number, name, birthday, residency address, and then you name it. And then they actually are a scam. You know, Social Security are not calling anybody, period. Okay, so that is very important. I always mention it because you need to be aware. You know, some people don't realize that. They thinking it is a you know, a legit call, and they go forward. So be aware. No government should call you and ask you for your personal information unless you initiate the call. Okay, very important. Also, you may receive from salespeople selling you this personal protection equipment for the COVID-19, telling you if you have a Medicare number, then you can get masks, you can get gloves, you can get sanitizer, you can get a bunch of other stuff that you may not need it. If you get lucky, you may get some you may never see in those products after you give up your Medicare number. So be careful, don't do that. If you need something, ask your doctor. Not only for PPEs, but for any equipment that you think you need it, you know, ask your doctor. Talk to your doctor and have your doctor prescribe it. Don't go by a phone call. They want your money, they want your business, and they want your personal information. So be aware of it, okay? Now, protect yourself. Once you are doing that, you build a wall against all those, you know, frauds and abuse or scams. Then if you identify one, you detected it, then report it. Those are the 3 steps that you need to do. And who you report it to? To us, SHIP, to the state general attorney or to your county general attorney, you know, to Medicare, but report it. Don't keep it for yourself. That way we can, you know, do something about it. Okay? Important, very important. Now, if you are new to Medicare, you know, start doing your research. Never is too late. You know, of course, time runs. There is a lot of information to processing here. Medicare is very complex, as you already know. Many of you probably already know, you know, but that's what SHIP is here for, to help you. So if you need assistance, you know, if you need counseling, unfortunately, we are not allowed to do in-person counseling, but we always be, you know, reach out to you by phone, okay? So you can call us, you can leave your name, a detailed message of what you're calling us for, a phone number where you can be reached. Unfortunately, also for limitation with our counselors, it takes us a little longer to return the call, but don't worry, we will call you back, okay? Nobody's gonna say, SHIP never called me. We may take a little longer, but we will call you, okay? And that's the best way to get information through us. Now you can also go to our website and do some reading in there. It's summarized, Medicare is summarized there. So it will be helpful for you to do that. Or you can email us. You can email us to our SHIP email, which is ship@accessjca.org. Okay, you can see it here in the screen. That's me. So our email again is ship@accessjca.org. If you need to call us, you can call us at 301-255-4250. And we'll be more than happy to answer all your questions, okay? So right now, we're gonna proceed with the questions and answers. So Mary?
Hello, we have some questions. The first question is, a doctor required to tell you if they drop Medicare participation?
Yes. By Medicare rules, they supposed to tell you. As a matter of fact, some doctors even put a big sign in their office to let you know. And guess what? They do that because many people don't read signs, you know, and they can say, you were advised, we have a sign out there, you never read it. They can say that. The doctors are very smart.
So is that the only way that they can notify you, or do they send a letter, or
well,
what?
if they're a participant and tomorrow they decided that no longer will participate, they need to notify you by mail. They need to let you know.
Okay. I'm got some other questions. Can you switch back and forth from traditional Medicare to an Medicare Advantage program, or are you locked in once you go to a Advantage plan?
No, you can go back. You know, you can do, if you are original Medicare, you decided to join a Medicare Advantage plan, yes, you can do that, okay? But you have to be, or you have to think about your Medigap Supplement. Remember, when you enroll at your initial enrollment, you have a 6-month guarantee issue right to pick your Medigap or Medicare Supplement. In those 6 months time frame, you will pay as the insurance advertise, you know, based on your age. If they say you pay $130 at age 65, that's what you're gonna pay, no questions asked. And you have 6 months to pick your plan, or you can switch in between Medigap plans for 6 months, the first 6 months of your initial enrollment period. After that, Can you shop around and buy Medigap Supplement? Yes, you can, but it's going to be very costly. You're going to be under medical underwriting. They're going to ask you a lot of questions, and they will charge you whatever they want. So going back to your question, can you switch from original Medicare to Medicare Advantage for 1 year and then another year go back to original Medicare for 1 year and then go back to, yes, you can, but it's going to be very costly. You know, I mean, nobody's telling you no, don't do it. So you need to be careful by doing that, okay?
Another question. Are you familiar with a program partially underwritten by Medicare, which provides 4 pieces of medical equipment for free? The equipment is a thermometer, a blood pressure cuff, a scale, and a pulse oximeter. I believe the company which supplies the equipment is called Scholar and paid for by Medicare. Apparently, this is a result of Maryland Emergency Act involving COVID-19.
It's possible. I have not read anything in regards to free equipment, as you call it. If Medicare is paying, it's not free. It's free for you because you are not paying, but a Medicare probably is paying for it. Okay, so when you refer to free, it give me the idea that anybody can go there and get them. If you are a Medicare beneficiary, probably you won't have to pay, since it's part of Part B, probably you don't have to pay the 20%. Medicare will take care of it.
If, is there any way that I can check to see if this is a kosher thing? If this company is on the up and up?
Yes, you can go to the Medicare.gov site and you can look for providers, medical equipment providers, and you can find the based in your zip code, you can find them.
We have another question. If I sign up for Care First as my Medigap, since it is not a nationwide plan like United Health, will it be effective if I move and become a resident of another state that's not Maryland, DC, or Virginia?
Yes.
Who makes these rules?
Well, Medicare allows you, if you move to another state, allows you to actually switch to the state Medigap or Medicare Supplement providers. You will have about 63 days to do that. Okay, so once you move.
If the Medigap goes with me to another state, how will my rates be affected? Who will submit my Medigap supplement claim?
Medicare, this is what happens. Doctors do not submit claims to Medigap insurance companies, neither the Medicare beneficiary. When Medicare does the Medicare summary notice it, they indicate there, they have already the Medigap information, and in that notices, they indicate how much the doctor is paying and how much is the patient responsibility. So what they do, they forward that same notices to the Medigap insurance for them to pay the doctor. That's the way it is.
Okay. Should I stay on my spouse's health plan through his employer? What factors should we look at?
Okay, if you are reaching 65, working or not working, but you are under your spouse health insurance coverage and your spouse is still working for many years from that moment, hopefully, you don't need to enroll in Medicare at all, because as far you have a wife, the employer that provides the health insurance is providing you what is called a group health insurance coverage. A group health insurance coverage means that the employer has to have 20 or more employees covered under that insurance plan. 20 or more employees. If that's the case, then you don't need to enroll in Medicare, period, until your husband or wife retires. That's when you enroll. But what happens, a lot of people decided to enroll just in Part A because you don't have to pay. If you have worked you 10 years and you have made you 40 credits, Part A is going to be premium free for you. Okay, and then a lot of people just enroll in Part A, and they will enroll in Part B when their spouse retire from work. So that's one. Now, I wanted to mention it and make a little stop here about a lot of people have that, but also they have health savings accounts. So you have health savings accounts, and you are reaching 65 and you continue working, okay? Do not enroll at all in Medicare
You can come outside.
until you retire. And when you know when you're gonna retire, stop paying or contribute to your health savings account 6 months prior. It's a lot of people made that mistake. They don't stop contributing because they stop when they enroll in Medicare. And unfortunately, when you enroll in Medicare, you delay your enrollment. Medicare, your Part A is going to go back 6 months. And the Medicare rules say that you need to stop paying your health savings account contributions once you enroll in Medicare. So if they go back 6 months and you have been paying, you know, you're going to be at fault. So be aware of that. But those 6 months are very important if you have a health savings account. If you don't have a health savings account, you don't need to worry about it.
Raphael, this is Beverly with a clarifying question. You said that if you have your spouse, with your spouse, you don't have to sign up for Medicare, but if you don't sign up at 65, isn't there a penalty that you have to pay for the rest of the time you're in Medicare if you don't sign up by the time you're 65?
The penalty will apply, as I mentioned it before, if you are not in an employer group health coverage. But if you are part of the employer group health coverage, no penalty will apply. That's one of the requirements from Medicare in order not to be penalized. But if you just decided not to enroll because, hey, I'm healthy, I want to save money, I enroll at 70, yes, you're going to be penalized.
Okay. If all standardized Medigap plans are alike, why do the prices differ between the companies? And why should anyone sign up with any company but the cheapest one?
There is two reasons. Why the prices are different. I believe the main reason is for the number of member enrolled. That determines the premium. If you have very few members, the premium will be higher. The more the members, the premium will be lower. So that's one of the reasons. It could be other reasons as well, but that's the most common reason. Okay, or I better say the most applicable reason. Now, why you should go to the cheapest one? Good question. There is 3 types of Medicare supplement insurance plans. Attain age, okay, community rated and issue age. The attained age are the plans that will increase, you know, in a time that they set up. The increase can happen every year or every 5 years based on the insurance that you have. And they will increase as you get older. Those increases will happen no matter what. Additional to that, the insurance will increase your premium for changes in the policy, changes in cost of living, and any other changes that they apply and increase to your premium. The issue age plans are plans that will increase only if there are policy changes or cost of living changes or any other factors. Will not increase as you get older. That's the issue age. Community rated is the same way, but the difference is that community rated, when the increase happens, it happens for everybody at the same time, at the same level. That's why it's called community rated. And doesn't increase as you get older. So the cheapest one, I guarantee you, are attained age. So in the long run, you're gonna probably start very cheap, but in few years in the row, it's probably you're gonna catch up with the other ones, and even you will surpass them later on. So you're gonna pay more likely. So that's why it's very important to see what type of insurance you are getting in, okay?
How do you know what kind of, how do you tell if they're attained age, issue age, or community rated?
Actually, in the Medigap book that is in the Maryland Insurance Administration website or in our website, in the first pages, you will see, you know, description of each one of them. What type of insurance means first. And then in the following pages, you will see the insurance company's name, the charts, and how much they charge per plan and per age. In the corner, in the right corner of that same page where the insurance name is or contact information is, you will see the type of the insurance. It will say attained age or will say issue age. That's the way to find them. And I'll be honest with you, Maryland mainly are attained age. You will find only few issue age and only one community rated.
And what's the community rated plan?
That is United Healthcare AARP.
Can you talk about the different plans such as Plan F, Plan G, etc.? How do you determine what plan is best for you?
Again,
Can SHIP help us pick the best plan for an individual?
What SHIP is, I wanted to make sure that everybody understands, SHIP is not an insurance broker. We will not tell you, this plan is good for you. We cannot do that. But we can tell you, and we'll give you information, enough information for you to make the right decision. Okay. For instance, if you ask me which insurance is better for me, you know, I cannot tell you because personally, I don't have any experience with that insurance. So how I can tell you, oh, this insurance is good? I can't. Besides, everybody has different medical needs. So insurances go by services that they provide. What happens if the insurance I recommend to you doesn't provide, you know, or cover your medical needs? Then you're going to come after me and say, you told me to enroll in this plan. See, so it's very difficult to tell somebody this is good for you. It's very difficult. I don't even tell my mom that because, you know, she may have some medical issues, and that this particular insurance that I recommended may not cover, and she's gonna, you know what she's gonna do to me. So it's hard. It's hard, but we can give you enough information for you to determine which plan is good and what insurance may be good for you. You know. In regards to the Plan F, Plan G, or N, or Plan N, how do you determine which plan covers what? In the Medicare supplemental policy book that I mentioned it, that you can find in the Maryland Insurance Administration in our SHIP website, actually there is a chart there that will tell you each plan and what it covers. So you will determine there which plan is good for. Once you identify the plan that you wanted, then you go to the next pages and start looking for that particular plan and who sell it and what type the insurance is and how much you're going to pay for it. That's the way to do it. If you need help, you know, a little bit more explanation about the difference, for instance, in between Plan G and Plan F, I can help you with that. I can actually tell you right now the main difference in between those two plans. And the main difference is that Plan G doesn't cover Part B deductible and Plan F does. That's the only difference. But also the premium can be very substantial money-wise and different. So see, I'm telling you something. And how much is the Part B premium annually? If somebody remember? Only $195. So some insurances sell you Plan F, you know, that will cost you annually $600 more than Plan G to cover how much? $195. So I ask you, which one you go? So that kind of the counseling we give you, you know, we don't tell you, hey, you need to go F or you need to go G. We just give you the facts and you made the decision.
Okay. My husband and I have Medicare Part A and receive health insurance through his work insurance plan. We would like to change to original Medicare for January 1, 2021. When do we register for Medicare B and D and supplemental insurance?
Mary, in the beginning you were breaking a little bit. So can you repeat it, please?
Okay, my husband and I have Medicare Part A and currently receive health insurance through his work insurance plan.
Okay.
We would like to change to original Medicare for January 1st, 2021. When do we register for Medicare Parts B and D and supplemental insurance?
Okay. If January is your month to start, then I would recommend you to enroll in Part B by the end of this month or by the beginning of next month. And you can do it online at the Social Security Administration website. There is a special enrollment Part B application there only for people as you, with the same situation as you. Only for people who has a special enrollment period. So you can enroll there and you can indicate there that you want your Part B to start January 1st, 2021. Okay, that will take care of the enrollment piece. Now, what do you need to do in order to get prescription drug plans? You do actually go to the Medicare.gov. If you are taking few medications, you can do actually the prescription drug health plan finder at the Medicare.gov website. And you can put the medications that you are taking and they will, for 2021, and they will give you the plans that will be more, you know, cost effective for you. And you can find few plans there for you and your husband. And then you also can call them, enroll them, and that will be effective January 1st, 2021. Now, in regards to the Medicare supplement, you have to wait until your Medicare Part B is active. And you have 6 months from that point to pick your Medigap supplement, okay? That doesn't mean you cannot contact the company right now. You can contact the companies right now. But the prices that you are going to be, quote, are for 2020, not for 2021. That's the problem. You have to wait to get an accurate quote. You have to wait until January to contact the Medicare Supplemental or Medigap plan to get an accurate quote about how much you're going to pay. Okay?
Okay. If you have a doctor before you enter Medicare and then continue to see them after you enter Medicare, is it safe to assume that the care will be the same? Does the doctor staff perceive it differently?
That's a good question. That should be a question for the doctor. They are the one who provide the service. There shouldn't be any difference. It shouldn't. So they have a professional obligation to provide the same services. Not because you are Medicare, it's going to be different. I don't see any reasoning on that. But if you want to know for sure, then you need to ask your doctor. Doctor, if now I'm Medicare, your services to me will be slightly different or no difference at all? It shouldn't be. It shouldn't be.
When you go to the doctor, do you give them all your medical cards or just your Medicare card?
Actually, you can provide the doctor with your Medicare and Medigap information. It's not that the doctor is going to bill Medigap, but they need to know what the check they are getting for your services provided to you. They want to know from where that check coming from, So, but not because they're going to bill you Medigap, but it will be a good idea to provide them with your Medicare card and your Medigap information. You don't have to give them your prescription drop information because I don't think they're going to do anything with that. The doctor only will prescribe you. You take that prescribed to the pharmacy and you provide to the pharmacy your prescription drug plan. And they are the ones who are going to tell you if that medication is covered or not.
Okay. For my supplemental plan, if I want to change from a high deductible G to a regular G after my first year, is underwriting required? I was told it's not required because regular G is considered a lower level plan than high deductible G.
And under that circumstances, in Maryland, everybody is required after the 6 months. The insurance have, the right to put you under medical underwriting, even with the same insurance. So if you want to move from one particular plan to another plan, in this case, high deductible G to regular G, the insurance may ask you questions. The insurance also can deny the movement. They can say, "No, sorry, no can do." So they don't have any obligations with you. After the 6 months, you guarantee issue rights are gone. In other words, they would probably tell you, take it or leave it. Unfortunately, it's that way. But some insurers are more, benevolent, if you want to say it, and they allow you, but they ask you questions. And if they're satisfied with the questions, they make you make the move. If they believe, based on their question, you are a high risk, they probably will not make you change. And there is nothing you can do about it.
Okay. Can you describe the SHIP Part D prescription drug plan coverage analysis service?
Yes, what we do, we provide these services for many, many years to all our Medicare beneficiaries in Montgomery County. It's a free services. Previous years, we were doing it by paper only. We mail a form to all our Medicare beneficiaries that requested it, and we mail them. They provide information. We go to the Medicare.gov and do a plan finder for them, and then we find at least one or two Part D plans that are, more cost effective for them for the following year. This year we are improving a little bit, also due to the COVID. We have, using an email reply. So we will reply to you by email, secure email, if that's why you requested it. So we won't use the regular mail. We will email you back. That's one feature. The other feature that we have added is the electronic form. You can go and complete the form in there in our website, and we will get it and we will take it from there. Also, you will let us know in there if you want your result by email or by mail. And we will do that. Now, we have a team of specialized counselors that will go and do the analysis one by one. They're going to go to the Medicare.gov plan finder. They're going to put you medication information in there, and based on that medication that you provide, information that you provide, the Medicare system will tell us which plans are more cost effective for you. Once we identify at least one or two plans that are good for you, then we complete what we call a comparison letter, and we send it that comparison letter with a copy of your own form that you submitted. So you will see what you submitted, what the results are. And that can take between 1 to even sometimes 3 weeks. So be patient if you submit your form to us, okay?
Okay. So you were talking about doctors who accept Medicare or who participate in Medicare. Is there a central location where you can find those doctors that accept Medicare?
Any Medicare provider can be found in Medicare.gov. That includes physicians, specialists, places to buy medical equipment, labs, everything you can find in that are Medicare participants in the Medicare.gov site. Now, usually you need to make a call before you even show up, okay? Make sure that they continue taking new patients.
Do any plans provide coverage outside the U.S.?
Unfortunately, no. Only very, very specific. But if you are traveling to Europe, and not that you're traveling now, under the current circumstances, nobody's traveling. But in the future, if you decided to make a nice trip to Europe, unfortunately, if you get if you have a need of medical care, Medicare will not cover you. So what we actually recommend is to get the right Medigap plan, which offer coverage outside the U.S. as an additional to their regular coverage, or buy a travel insurance. The only time that you may get covered outside the United States is in the borders. If you are in the border with Mexico or the border with Canada. If you have medical need, emergency medical need, and the nearby hospital is in the other side of the border, so they will take you there, and they will actually pay. It is in Canada or Mexico, they will pay that hospital for the services provided to you. And that's the only time, because it's nearby and you are having an emergency. Other than that, sorry, they will not cover.
Can I switch Medigap plans during open enrollment?
Open enrollment is not to switch Medicare plans. Actually, you don't have any open enrollment of special periods to switch Medicare plans. Again, you can switch at any time. The problem is that it probably will represent more money for you. So you can do it at any time if you want, but be careful. Be careful what you're gonna get.
There don't seem to be any more questions.
Good. Maybe we cover everything.
Oh, I'm sorry. Wait a minute. Can you talk about the extra Medicare payments for people making more than $80,000 a year?
Yes. What happens is when individually, if you are a single person and you make more than 80,000, a year, you probably end paying a little bit over $200 or $189 for Part B premium. As a couple, you have to be over 160, if I'm not mistaken, in order to also pay the amount. Again, Social Security is the one who manages those premiums. They are the one who calculate based on your income tax from the previous 2 years of enrollment. And many people ask this question about, okay, that's 2 years ago, but right now my income is different. I'm already retired. I don't have all the benefits I used to have before, so my income has dropped. So how am I going to continue paying that high premium? You don't have to. What you can do is you need to contact Social Security Administration and request from them a Medicare Part B premium adjustment. What you have to find out first is when you can make the adjustment, and second, where or when you need to submit the request. Once they do the adjustment, obviously your Medicare Part B premium will drop based in the current income.
Okay.
Go ahead.
I'm sorry. What is it called?
IRMA, like income monthly related. I think it's that way. Income monthly related adjustment.
And just to supplement what Raphael is saying, and you will get a refund if, once they determine it, it goes back, say you've been paying it up until March because you're adjudicating your case. They will go back to January and reimburse you in a check. If they say that, yeah, you're making less money, you can prove it, we'll reduce your premium and give you your money back for what you were paying extra, but you got to pay it until they give you that decision.
Yeah, and that, as Beverly mentioned it, thank you, Beverly. As Beverly mentioned it, it's all based when you are submitting and what you are requesting. Probably that was, people may get some reimbursement, some others don't. So it's not that everybody, because you are requesting it, everybody's going to get reimbursement, okay?
Okay. Does the pharmacy also need both insurance cards for the flu shot and the pneumonia shot? They just took the Medicare card.
Pharmacies, they should take the Medicare for, for those shots. But if I will do it better in a doctor's set office instead of any of those pharmacies. Because your doctor is a Medicare, provider, and they know how to build all these things. And you may take a risk that the pharmacy doesn't build it properly, and then you're gonna end paying for it. Or the pharmacy maybe tell you to pay upfront, and then you request the reimbursement. So it's better to do it in your doctor office. It's just a recommendation. I mean, you can do it wherever you please.
Does Medicare cover the cost of a shingles shot?
It does cover.
Okay. There aren't any more questions. Unless somebody has one that they haven't submitted on chat.
Yes, if anybody has anything, you can just unmute yourself and speak if you'd like to right now.
Does Medicare pay for the Shingrix shot specifically, not just any shingle shot, but Shingrix?
That is a very detailed question. I have to dig more into it in order for me to answer you. I don't want to give you inaccurate information. So, it's if you go to the Medicare.gov, actually they can tell you right there, the specific shot that you want to take is covered and how much is covered. I don't want to say something that maybe, misguide you.
Okay, thanks.
Yeah, Shingrix is two shots, so there's that's the whole question about whether they're covered. I have to take it too. I have to take a second one, but I have to find that out. I apologize to those of you who were in the waiting room and waiting, and that was something. Well, next time it won't happen. I promise you that. And we will have the whole presentation up on the website. So what you missed in the first half hour or 45 minutes, if God forbid it was that long, you can certainly check that out. And we thank our presenters very much for being with us today. You've certainly given us a lot of information. We're still going to be, I'm sure some of us are going to be still processing this for a while. That's the problem with Medicare.
Barbara, I just want to add, for those that has missing the initial of the PowerPoint, if they have more questions that it doesn't, or anybody in the audience that have more questions that probably come up later on, please give us a call.
Okay.
We are waiting for you to.
We sent the PowerPoint to everybody who registered, or at least.
Wonderful.
Yeah, so that at least they did get that as a PDF from that. We thank Mary for that. So I think at least we had that much, but I'm sure there'll be questions. People will have individual questions, and I'm glad that you are available to us in the future. And I'm going to say to everybody again, sorry about that. We are going to have another program we hope coming up in the next 4 to 6 weeks. Watch the website. We're going to try to keep it current and have news you can use in terms while we're home. All of us are home. Information, and we look forward to hearing from you. Thank you.
Great. Thank you.
No, thank you.